dedicated to empowering you with information
to make positive choices
and be advocates for your overall well-being.
Welcome to The Health View. Welcome to The Health View. I'm Yvonne Dunitz, and our topic today is about the human burden of environmental toxins, their common health effects, and how to protect ourselves. My guest is Dr. Walter Quinion, who has over 30 years of medical practice and is considered one of the foremost experts in the field of environmental medicine. He started the environmental medicine classes at Bastyr University, University of Bridgeport College of Naturopathic Medicine, and the Southwest College of Naturopathic Medicine, where he was able to start the Department of Environmental Medicine that he chaired from 2003 to 2013. He also does 6-month training courses for licensed healthcare providers who wish to become more proficient in environmental medicine. He founded the Naturopathic Association of Environmental Medicine, a specialty board for practitioners in this field that sets standards of care and provides board certification in this area. Dr. Quinion lectures across North America and Europe at medical conferences where he is a sought-after speaker. His first book, Clean, Green, and Lean, was published by Wiley & Sons in 2009 and is an excellent overview of environmental medicine and how to lower your burden of environmental toxins and regain your health. He has been a guest on ABC's The View 3 times with Barbara Walters, talking about toxic compounds in our everyday environments and how to protect ourselves. Dr. Quinion was also asked by Huffington Post to be a blogger on their site, providing all of their readers with current and accurate information about health and the environment. He was the editor of the environmental medicine section of the journal Alternative Medicine Review until 2014, and has been appointed to the editorial review boards of the New England Journal of Medicine, Pharmaceutical Biology, Science of the Total Environment, and the International Journal of Hygiene and Environmental Health. Dr. Quinion has also authored over 25 articles that have been published in peer-reviewed journals available on PubWell. Please join me in welcoming via Skype Dr. Walter Quinion. Dr. Quinion, it's a pleasure to have you with us today, and I'd like to jump right into the topic of what are toxic compounds that we should be aware of that affect us and our health in the environment that we live in today.
That's a great question, Yvonne. Thank you for having me on. I'm giggling now because the environmental burden that we're exposed to is so huge. You know, one of the funny things is I'll get other doctors contacting me and they say, Walter, my patient isn't exposed, but I'm concerned that maybe they're toxic. And my response to them is, your patient dead? Because everybody who's alive is exposed daily to a huge number of pollutants that are toxic to us. Just from we've got really bad habits, Yvonne. We've got a bad habit of breathing and eating food and drinking water. And just the fact that we're breathing air provides pollutants into us every day. Now, people that live in certain areas of the country and the world breathe in a lot more toxicants than others. But still, just urban living in an urban area and breathing urban air is such a huge risk for the chronic diseases that we all have. Cardiovascular disease, it's more strongly linked to vehicular exhaust, urban air pollution, than cholesterol. Diabetes, obesity, these are all linked to breathing urban air. And, you know, if you're in the rural area, I mean, you're still exposed to air pollution. And in some cases, then they've got more pesticides, et cetera. But these are the things that we are just exposed to now every day.
So what does one do?
Oh, well, you could put duct tape over your mouth, I guess, but then you're dead. So,
Right?
yeah, let me just talk about the CDC for a moment. For the
Okay.
last few decades, they've linked up to work with the data from the national, what's called the NHANES trial, a National Health and Nutritional Examination Survey that's been going on for decades, to get a general assessment of the health of the average U.S. resident. And over about the last 20 years, they've started to measure these, U.S. residents' blood and urine for toxicant compounds. And they have now got up to studying 246 toxin compounds in the blood and urine of the average U.S. resident. Of those 246, 108 were found in everybody. Everybody. So that's not quite 50%, right? But it's still a high percentage. And those pollutants, they're plasticizers, perfluorocarbons from Scotchgard and cooking with Teflon. The plasticizers are from wearing fragrance, personal care products with fragrance, or consuming food that was either cooked in or stored for a long period of time in saran wraps, or just the plastic off-gassing from your shower curtain or plastic things in the home. um, Solvents from vehicular exhaust in the urban environment, or solvents in your home from your cleaning products, or from the new carpeting or the cabinetry in there. We're assaulted with these things. Now, I was just spending this morning reviewing studies on using air filtration and air purifiers in the home. And even a simple air purifier that pushes air through electrostatic filter uh, gives great reduction in inflammation in the body and cardiovascular. It drops blood pressure, for crying out loud.
Mhm.
So um, one of the things that I've been saying now for years, it's been eat organic food, drink clean water, and take your supplements. But now, Yvonne, I'm at the point where I'm telling people spend $1,000 for a high quality air purifier and put it in your bedroom. I think that is really come down to, with the pollution that we have, a critical factor for people's health. And let me give you one simple example: autism. Now, there's been a lot of concern about what causes autism. Is it the thimerosal from the immunizations? Is it mercury cause? And there's a huge debate about that still. But what's not debatable, there are now probably about 8 studies that have looked at women and how close they live to a busy highway with a lot of truck traffic. The closer they live to that highway, the greater their risk of having an autistic child. And if the woman keeps living there, the child's autism gets worse. This is documented. It's not just one study. There at least they did about 4 studies in LA. They've done others back east, and it continues to be shown. These toxic. So you can prevent having an autistic child by putting $1,000 air purifier in your bedroom. You can also improve your rate of being able to conceive by having one in the bedroom. So for $1,000, you can alter that child's life completely. Or for being not willing to spend $1,000, you can totally alter that child's life. I mean, if you can't move, right? Some people got to live where they live because of their job, but by golly, you can get $1,000 out of your budget somewhere and buy a high quality air purifier that can totally change your life, your child's life, your health, can knock out asthma, can reduce your risk of cardiovascular disease, diabetes, and obesity.
In that small amount of time of when you're sleeping in your bedroom versus all the
Yes.
hours during the day when you're actually outside in the environment, it will offset it.
Well, you're in your bedroom for probably what, 8 hours sleeping,
Yes,
and you're getting dressed and you're getting ready for bed. And so
right.
you're probably up to at least 10 hours a day. In a 24-hour day, that's the room you're in the most.
So I would think anybody with a baby or a child, it would behoove them to have that in their room also.
Yes, and then spend another grand and get one for the living room.
For the
Now,
living room.
if you're in a small enough place, like I just read one study that they did in Shanghai, China, with college students in these dorm rooms that were 65 square feet, and the 3 to 4 guys in the dorm room, right?
Ah,
And they just did it for uh, two 24-hour periods on weekends. They had them stay there the whole weekend. And for one of the 24 hours, they had the filter in the air filter. And the other 24 hours, they had the air filter running, but no filter in it. So that's how they did the placebo, right? The
yes.
machine's there, it's plugged in, the lights on, you can hear the fan running, but there's nothing in there to filter the air. And just for 24 hours, that dropped their inflammatory rate. But so if you're in your bedroom, and if it's a small area like that dorm room, if you got an apartment, the IQ Air, which is what I have in my bedroom, and I'm not hired by them. I have no stock in the company, or I get no money from them for sales. But
But
that's the one I have.
that you consider a high quality air purification
Yes,
system.
yes. It's out of Sweden. I tell you, those Swedes, they're the ones that made the Volvo, the safest car ever, right? They're very into indoor air quality. Some of the best research comes out of that area. The So that's what I have, because there are a lot of high quality machines that go through. There's 3 different filters in my unit. I could actually pick this up and walk into my bedroom and show it to you. There are 3 different filters: a pre-filter, then HEPA filter, which is high efficiency particulate filter, and then a thick 5-fold charcoal filter. So it clears all this stuff out. Now, that unit is probably good for at least 1,500 square feet. So I've got it in my bedroom, and it's going to end up, since I have it on all the time, clearing the air in my entire apartment. So I don't need a second one out here. If I had a 2,000 square foot home or 3,000 square foot home, I'd get 2 or 3. But for most people in a little space, they just need the one, but keep it in the bedroom.
So it's an interesting solution. So you're saying that air quality in itself has a significant effect on one's health. And a
Absolutely.
simple decision and choice of getting a high quality air filtration system within your bedroom and in your home can literally decrease the environmental toxic impact on your health and well-being.
Absolutely. And this has
What
been documented now in several studies, primarily looking at cardiovascular response,
Okay.
primarily is what they've looked at.
What other toxins should we be aware of, and how people can protect themselves? What are the things that we can make them aware of and help them to know the simple changes that they can make to help them with their health and well-being?
Well, so some of the others are things like the perfluorocarbons, which are in Scotchgard material and Teflon cooking pans.
Mm.
Now, one of the, um, when it comes to air pollution, the vehicular exhaust stuff that anybody in an urban area is breathing, those things don't stay in the body long. They're not persistent. Perfluorocarbons are more persistent. So air pollution from a vehicle, what you breathe in, it's gone within hours in your body. So getting a good air purifier, if you do that, this stuff is simply not going to be in your bloodstream in the same level. Perfluorocarbons are a little bit different. Now, they are bound in the dust of the home, so a good air purifier will clear them out too. But they're going to stay in your body. That stuff that's already in there is going to stay there for years. And it's associated with a lot of problems. And in places like, I think it's Boulder, Colorado, just found that they had it in their water supply, these perfluorocarbons. So the perfluorocarbons, stop cooking with Teflon. It's not worth it.
Okay, so then go to
You know,
stainless steel.
go to stainless steel, any of those nice um, multi-layered cookware. Costco, I get no money from Costco. They've got a nice 5-ply I think it's 5-ply cooking set there. I just moved back to Arizona, so I went to Costco, $179. I got a set of really nice cookware,
Okay.
you know,
So that's a
and
change that people can make. So
so
get
that's
rid
a
of your
change.
Teflon and those
Get rid
types
of
of
your
pans.
Teflon. Now, so let's talk low-hanging fruit. Get rid of the Teflon.
Okay. What
Don't
else?
smoke indoors. Don't
Okay.
wear your shoes indoors. Take your shoes off when you walk in because you're going to be dragging in all these pollutants from walking across the parking lot and everywhere else, and that gets in the dust. You have to control the dust in your air. So here's a couple of other simple things to do. You're probably getting envelopes once a month at your home with all these discount coupons in there, right?
Yeah.
Val packs or something. So find the ones that are give you a discount for having your ventilate your furnace ducts sucked out, cleaned out. They come with this fan with this gigantic, you know, vacuum hose, and they'll suck out all the dust in your furnace vents. The toxicants in your home air aren't free floating. They carried on dust. So you got to have dust control. So get the duct sucked out. It's going to cost you 150 or 200 bucks, whatever it is. And then you replace the furnace filters with the high quality pleated air filters. They look like little paper accordions in the box, you know.
Yes.
The more dense the pleating, the better it is.
Okay.
Get the electrostatic ones and replace those. And that way you're not allowing more dust into the vent. If there's already dust in the vent, no matter the quality of your filter, there's going to be dust blowing out. So get a company in that'll suck all that out. Then
Okay.
put the good quality air filter in, and you have your air purifier on top of that, because your furnace system simply isn't set up to have a thick filter with a good seal and be able to push all the air the way you need it to be cleaned.
Okay.
If you've watched your furnace filter when the furnace is on, you see it kind of suck up,
Yes.
you know. And so you know that the corners are also turning, so there's some air going around the filters. It's just the way
Sure.
it is.
All right.
So
So
that's
what
why you
else?
got
So
to
that
set.
would be a good thing to do. Okay, then
Yeah.
what next? So we get rid
So
of the Teflon, we get
that's
an air filter, we check out and
you
clean out
clean
our
the
dust.
ducts. You buy the you buy the filter that's 15 bucks a pop rather than $2.50. Okay,
Yep. You get a
and
nice
then
pair of slippers just for the household. As soon as you enter the door, leave the street shoes out and in. What else can we do to change up our and support our health and clean up the
so
toxins?
so then you got to control the fragrance products in the home.
Okay.
So that would be the scented bounce.
Okay.
Not using that, not using all the personal care products, as I mentioned, which are high in anything with a fragrance you put on your body, shampoo, whatever, is high in plasticizers. These are the low molecular weight phthalates or plasticizers.
Okay.
Now, the greater the amount of plasticizers in your urine, both low molecular weight from your fragrances and high molecular weight from your food and your shower curtain, the higher those are in your urine, the bigger your belt size, the more
Okay.
weight you carry. Whether you're a man, whether you're a woman, whether you're a child, those have all been studied, all been documented in the literature. So you
Okay.
stop using those fragrance things
All
in
right.
the home,
Yep. So
and
you get
and
environmentally clean products.
yeah, and you stop using all the solvents to clean everything in
Right.
your home. Go
Go
back to
back to
vinegar
vinegar and water.
and water, and go back to, Bon-Ami scrub.
Right.
You can reduce all that stuff. Now, if you really want to take the next step, all those things are low-hanging fruit. They're easy to do.
Okay.
And I've got my book Clean, Green, and Lean, which actually takes people. There's a whole chapter on your house on a diet and
Yes.
how to go, what the checklists are to get all that junk out of your house.
Uh-huh.
Um, Now, those are low-hanging fruit. The next big step, which people often do not want to do, is take the carpet out of the house.
Okay. Go to wood
But
floors.
yeah, I don't know. Have you ever pulled the carpet up in a house?
I have.
And what was your experience when you did that? Were you astounded at how dirty it was? And there's an amazing amount of the finest dirt you've ever seen in your life, not just under the carpet, but under the pad. It's like, how did that get there?
It's the
Carpet
truth.
is a huge sink for toxicants. I mean, they've done studies on where pesticides stay in a home in the carpet, bound to the fiber. And so if you got kids crawling on carpet is the dirtiest thing you could ever do to your home. It's the most not only is it loaded with hundreds of chemicals, many of which are neurotoxic. They're toxic to your nervous system and your immune system, but it also holds all the other toxicants released in the home. So our outdoor air is toxic enough. And then that's what's in our indoor air. Plus, we add all this other stuff to it that just makes it worse. So that is the next step. I have not had a carpet in my home for decades now.
What about mattresses and pillows?
Oh, thank you. So what we've realized recently from the wonderful work of Dr. Aviad Elges, he's a naturopathic physician in Toronto, Ontario, Canada, and he is documented now, and I've confirmed it in my patients that the memory foam mattresses, the Tempur-Pedic mattresses, those, that are complete foam mattresses, they
Yes.
they cushion to your body. You got all the advertisements for them. They're the most expensive mattresses in the mattress store now. Those release several highly toxic solvents: benzene, styrene, ethylbenzene. Now, benzene is listed as a carcinogen because it causes cancer of the bone marrow. So does ethylbenzene. Now, all of those are also toxic to your nervous system. So your brain doesn't work right, your mood's not right, your memory's not right. Um, so it's a neurotoxicant. And this is probably before the memory foam came out, it was the flame retardants in the mattress that could make people ill. But now we're finding this memory foam, not only the mattress, but a memory foam pillow. And some people buy those eggshell foam toppers that they just throw on top of the mattress to take a not so good mattress and make it more comfy. All those are horribly, and I mean horribly, toxic. So this is a big issue in the bedroom.
And does that last for years as long as you have that?
Yes.
So
I
what
just
should you
I just
replace it with? What should people
you
replace it with? Because that's
so
a huge
you have
expense.
yeah. Well, the neat thing is the replacements are far cheaper. So as I said, I just moved. So I went to this one of the mattress stores, and I bought a Serta Posturepedic, which now all mattresses have some form of foam in them. They all do. It's to keep the mattress cooler when you're sleeping on it. But the memory foam is a different quality of foam. Yes, it's polyurethane, but it's a different formula. It's a different composition. So I got their Posturepedic, which was far cheaper and didn't have all that memory foam in it. If to get a total organic bed, you typically need a physician's prescription because otherwise, by federal law, they're supposed to put flame retardants in it.
Yes.
So right now, I'm more concerned about the memory foam and those solvents than the flame retardants because it's like a new epidemic out there
Really?
because those beds are. I now it's just been in the last few years I've been running these solvent tests and finding the benzene in people, and before that it was only showed up with people who had a vehicular exhaust leak. Their tailpipe was leaking into their car. But lately I've been getting all these other patients. I'm going, where's this benzene from? Where's the styrene from? And I couldn't find it until Dr. Elges presented this at our last conference going, hey, it's the memory foam. And now every single patient that I get, I say, what's your mattress? And it's always memory foam. Tempur-Pedic or the memory foam, name itself, or a pillow. And I have them take it out, and some have had it for 15 years, and I have them take it out, and I rerun the test 3, 4 weeks later, the benzene's gone, totally gone.
Wow, in that short a time.
in that short of time because it doesn't hang. No one should have benzene in their blood unless they're working around benzene. No
Yes.
one should have it.
Amazing. Now, doctor, we have 3 minutes left. What other important things do we want to make sure our audience learns about, of the changes that they can make related to toxic compounds and the choices they can make to change that up in their homes?
Okay, the last couple things is food. We've talked about air. The most toxic food on the planet right now is farmed salmon. It's
Okay.
Atlantic salmon. It can be farmed around the world. It's called BC salmon, Scottish salmon, Chilean salmon. If it's not king salmon, red salmon, or silver salmon from Alaska, don't eat it. Sardines, second most toxic fish. The canned sardines are loaded, both the farm salmon and canned sardines are loaded with PCBs, polychlorinated biphenyls. They're no longer made. It's a worldwide ban on manufacturing. That's how bad they are. And then you go to EWG.org, environmentalworkinggroup.org. Look at their shopper's guide. They have the 12 most toxic fruits and vegetables. That's where you get organophosphate pesticide exposure, which is a neurotoxin that was developed in Germany between the First and Second World War as a nerve warfare agent. So avoid those fruits and vegetables.
Okay.
Clean the air, watch what you eat, and you'll reduce your exposure dramatically.
Change the bedding that you sleep on. What about the sheets and the things that you put on top of the bed?
That's not, get
Not an
get
important
organic.
thing
Get
to be
the
aware.
cotton that makes you feel good, but don't do memory foam.
And the other thing that you said as we enter the house, to take off the shoes that you're using from outside, get just a house pair of slippers or whatever that you wear inside. But you mentioned about dust. Dust is an important thing to be able to clean out easily within the home through vacuuming and taking care of that.
Yeah, and that's why you get the air duct sucked out, put in the high quality pleated air filter, and use the high quality air purifier like IQ Air, Blue Air, Austin Air, any of those.
Well, this has been very, very helpful, and I know that we have tried to get a huge component of important information and kind of slice it out into a really small nutmeg here, but a critical part to allow people to make positive choices so that they can directly and immediately help themselves be in a better, healthier situation. So
Absolutely.
We look at our food, good healthy food, organic food. We take a look at getting good health filters in, air filters, getting rid of our shoes, get rid of our memory foam mattresses, get rid of pillows that are memory foam. And you have been just wonderful, and we thank you so much for doing this Skype interview with us. Bless you, have a great day, and take care.
Thank you, Yvonne.